Good morning. My name is Amelia McCutcheon, and I'm here and wearing my Chief Nurse Executive hat when I speak about this initiative. Sometime in September, and Karen Main is also going to speak about it in more detail. Sometime in September, the Ministry of Health sent out a call for proposal to submit projects, initiatives that will improve nursing work environment. Now, the premise, and this is logical and supported by research, is that if you have quality work environment, you can provide, or it certainly increases the opportunity to improve quality patient care, improve and provide quality patient care. So we had about 2-week turnaround time, right? And this was in end of August, early September. And so we sent out a call for projects and initiatives. So we sent out via e-echo and email, and it was a tremendous response from staff. And the one that impressed me particularly more so is the fact that the submissions were by teams, not just individuals. It was a team effort. So there were a lot of submissions, and we they had to meet certain criteria, so we decided to submit 8. And you know, all 8 were approved. And I know for a fact that not all proposals were approved. So I really want to thank those who submitted and worked with us in making the submissions. So I thank you, and I hope that we can see some really good outcomes after this. Now, the only disadvantage is we only have until the end of March for the funding. We receive about $290,000 funding, and it's really to pay the time of nurses and the support people. Oh, actually, it's just nurses that we can charge this to. So really appreciate your help, and I'd like to give Karen to talk more in detail what the initiatives are. Thank you.
Thanks, Amelia. So these are really very creative, frontline driven projects and initiatives, and so we just wanted to identify the nurse leads for these different projects, and that was one of the criteria. As Amelia had mentioned, the dollars can only go to backfill frontline staff or frontline nursing to do these projects, and the other criteria was that they had to be led by frontline staff. So it's all about staff development and engagement in these projects. So the first one is creating an efficient work environment, and this is going to be led by Sherry Purcell at the Ajax site and Miranda Rodufo here at the Centenary site. And just to give you some ideas of the pieces of work that they're going to be working on, they're going to be looking at medication administration, unit stock of medications, looking at best practice for change of shift report, and looking at possibility of hourly patient roundings and the benefits of that. The second initiative is creating a culture of patient safety. Diane Ringneck from Nyan East is participating in that, and that's already started. She's a very valuable team member of the IRIS team that's been building the incident management system. Diane has been giving feedback and making the system user-friendly for frontline staff. She'll also be involved in the training of other staff throughout the organization, so that's been very helpful. Number 3 is enhance patient and nursing experience for 2 patient populations, namely congestive heart failure and COPD. There's been a lot of background work already done on these 2 particular diagnoses and looking at the patient experience. And Maureen Stevenson from the Ajax site and Diane Allen from here is going to be, they are leading this particular project and are going to be doing a lot of initiatives around staff education, implementation of the care pathways and order sets, and looking at the sustainability of that. Number 4 is improving documentation and workflow in the birthing unit. Angie Stein is the RN working on that, and that's also already in progress. As you know, the birthing center went into, started using electronic documentation 2 years ago, and it's now time to evaluate that, streamline it, get staff feedback, and make improvements, and that's what Angie's working on. The fifth initiative is creating a highly desired work unit and developing unit nurse leaders. And this is going to be done in the cath lab, ICU, and OR, as well as CCU. And you can see that Yolanda and Trish and Namifa are the nurse leads here. And they're looking at nursing councils, they're looking at working environments, efficient workspace, and have already started some initiatives on that, some work on that starting before the new year. Number 6 is pediatric and NICU PICC line program. It's not necessarily inserting the PICCs, it's giving, for those who aren't clinically based, PICCs is peripherally inserted central catheters, and our pediatric and NICU population have been sometimes waiting days, if not weeks, to have this particular device inserted because they were needing to go down to sick kids, and then we didn't have the skill here to maintain it, or didn't have extensive skill to maintain it. So this is a program that's working on this to expand our expertise and develop our skill to be able to provide this service in a more timely manner for our patients. Number 7 is developing unit-based wound champions. Our nurse lead for this project is still being developed, but this is an extensive program throughout the organization. It involves, I believe, 6 different units where they're going to be developing wound champions, receiving education, and then moving out to other staff to share that education and training to the other staff on the units. Number 8 is creating a culture of staff engagement during a transition to a multidisciplinary model of care. As you know, we've had quite an expansion or a change of model in care in our post-acute areas. And Amanda White at Two North at the Ajax site and Brenda Barnes here at the Centenary site are leading this project. And they're looking at supports that are needed, training, and looking at other supports or other perhaps transition tools that are helpful as this group is working through this transition. So you can see very valuable pieces of work being done to support quality not only for our nursing staff, but for all interdisciplinary staff, as well as looking at patient outcomes and giving the best patient experience.